The call came in at 2:47 in the morning, and by the time the trauma team at Foothills Medical Center had the patient stabilized on paper. Vitals entered, triage tag attached, gurney locked into Bay 4. Nobody could explain why he was still alive. His name, according to the single dog tag recovered from his gear, was Sergeant First Class Edwin Marsh Delacroix, Canadian Special Operations Forces Command, and that was all anyone was cleared to know. The rest of his file was a wall of black redaction bars. The attending physician, Dr. Farouk Salim, had been practicing emergency medicine for 19 years, and he had never once seen a patient whose chart arrived with a government seal stamped across the admission summary. "He's not run to stimuli," one of the paramedics said, still pulling off his gloves. "GCS of 6 on scene, but look at him. Hospice. No structural damage we can find, no bleed on the portable, nothing." Dr. Salim looked. The man on the gurney was somewhere in his late 30s, broad-shouldered, with the kind of stillness that didn't read as unconscious so much as deliberate. His eyes were closed. His breathing was shallow but rhythmic. His blood pressure was low. Dangerously low, but it had been exactly the same number twice in a row, which was not what you saw with someone crashing. You saw variance. You saw the body fighting. This man's body was doing nothing of the sort. "Get me neuro on the phone," Dr. Salim said, "and someone find out who we're supposed to call about that file." Nobody called anyone about the file. The number listed was an Ottawa exchange that rang 4 times and went to a recording that said, in a flat administrative voice, that the party they were trying to reach was not available and that further inquiries should be submitted in writing. It was 3 in the morning. There was no one to submit anything to. What there was in Bay 7, folding a set of surgical drapes with the mechanical efficiency of someone who had done it 10,000 times before, was a woman named Sylvie Ouellette. She had been on the overnight rotation at Foothills for 11 months. Before that, she had been at a smaller clinic in Red Deer, and before that, if you checked her resume, there was a gap of 4 years listed as independent contractor, logistics and field support. Nobody had ever asked her about it. She was the kind of person people didn't ask things of. She was quiet in a way that didn't invite curiosity. She made good coffee in the break room and remembered which of the night shift doctors took theirs without sugar. And she did her job with a precision that registered somewhere in people's peripheral vision without ever demanding their full attention. She was 31 years old. She had a small scar above her left eyebrow that she had stopped explaining years ago. She had not slept more than 4 consecutive hours since October, and she had learned to function inside that deficit the way you learn to function inside altitude, by adjusting everything, by lowering your expectations of comfort, by refusing to let your body tell you what it needed. She heard the commotion from Bay 4, the way she always heard things on night shift. Through the walls, through the particular frequency of voices that meant something was wrong, but not catastrophically so. She finished the drapes. She washed her hands. She walked to the door of Bay 4, because that was what you did when the noise didn't resolve itself in under 2 minutes. Dr. Salim was standing at the foot of the gurney with his arms crossed and his jaw set in the particular way that meant he was out of ideas but not yet ready to admit it. 2 nurses flanked the patient. The monitors beeped steadily, accusingly, as if the machine itself was frustrated. Sylvie asked from the doorway. "Unresponsive. No identifiable cause. Government patient, which means we're flying blind on history." Dr. Salim looked at her the way the senior staff had taken to looking at her when they wanted help they didn't want to ask for. "You can go back to 7, Ouellette. We've got this." She didn't move immediately. She was looking at the patient, not at his chart, not at his monitors, at his right hand, which was resting against the gurney rail, and which was, she was almost certain, moving. Not much. Not in any way that would register as significant to someone who wasn't looking for it. The index finger, a pattern. Short, short, long pause. Short, long, short. Pause. Long, short, short. She felt something cold move through her chest. She knew that pattern. She had spent 14 months learning it in a classroom outside of Petawawa that officially didn't appear on any base map. Learning it until it was as automatic as reading. Learning it because the people who taught her said that one day she might need to understand a message, being sent by someone who had no other way to send it. She walked into the room. "Willette," Dr. Salim said. "I said we have." "I know what you said." She kept her voice level. She reached the side of the gurney and she looked down at the man's face. Up close, she could see the microtension in his jaw, the deliberate shallowness of his breath, the way his eyelids weren't simply closed but held closed, in the way you hold something when you are concentrating on holding it. "He's not in a coma." The room went very quiet. "I beg your pardon?" Dr. Salim said. "He's not in a coma. He's awake." She turned to look at the doctor. "Or something close to it. He's regulating." "That is not. His blood pressure is identical across 3 reads. You don't get that with loss of consciousness. You don't get that with organic compromise. His breathing is too controlled. Watch his diaphragm." She pointed. "That's not the rhythm of a man who can't breathe on his own. That's the rhythm of a man who's counting." Dr. Salim stared at her for a long moment. Then he looked at the patient. Then he looked back at her with the expression of a man who very badly wanted to be right and was beginning to suspect he wasn't. "Even if that were true," he said, and his voice had dropped, "which I am not conceding, why would he do that? Why would a man in a hospital feign unconsciousness?" Sylvie thought about 14 months in a building that wasn't on any map. She thought about the instructors who had told her, in the flat, patient voices of people, explaining things they expected you never to have to use, that a trained operator could slow his own heart rate to the edge of clinical undetectability, that he could lower his body temperature by deliberate vasoconstriction, that he could make himself look to every available diagnostic instrument like a man who was shutting down, and hold that state for hours, that the only person who might catch it was someone who had been trained to catch it, and then only if they knew what they were looking for. "Because he doesn't know if this is a safe environment," she said. Nobody said anything. She looked back at the man's hand. The finger had gone still, but she had caught it. She had seen the pattern, and the pattern had been SOS in SARE code. Not Morse, not the Civilciate version, but the modified variant used in survival training. The one that changed the rhythm intervals to make it harder to identify if you didn't know the key. It was the kind of signal you sent when you couldn't speak, when you couldn't move openly, when you needed someone to hear you without alerting anyone who might be listening. He had been sending it into the air of a hospital bay on the chance that someone might understand. And she understood. She did the thing that she had been taught to do, which was the thing that felt, in this context, almost impossible to explain to anyone in the room. She placed 2 fingers lightly on the back of his wrist, not on the pulse point, not in any way that would read as clinical, and she tapped. 4 taps. 3 taps. It was the ear response code. It meant, received. It meant, I know what you're doing. It meant, you are not alone in this room. His breathing changed, almost nothing, a fraction of a deepening, a single cycle that was slightly less controlled than the ones before it. But she felt it. She had been trained to feel it. "What are you doing?" one of the other nurses said. "Give me a minute," Sylvie said. "Willette." Dr. Salim's voice was carefully, professionally neutral. "I need you to step back and let me. 30 seconds, she said. She didn't look up. She kept her fingers on the man's wrist and she tapped again. This time not a code, this time a question. 1 tap. Pause, 1 tap. Simple, binary. Are you receiving? The finger moved once. She exhaled slowly. "He needs a verbal authentication," she said. "He's been trained to stay under until he gets a clearance phrase, or something close enough to one that his nervous system accepts it." She looked at the dog tag, still attached to the rail of the gurney by the paramedic's triage cord. The name, the number beneath it. "Give me the room." "Absolutely not," Dr. Salim said. "Dr. Salim." She turned to look at him fully, for the first time since she'd walked in. She used the same voice she had used in a different life, in a different context, when she had been the person in the room with the most information, and someone senior to her in rank had been about to make a decision based on incomplete data. She didn't raise it. She didn't harden it. She simply let it be what it was, which was the voice of someone who knew something that the person she was speaking to did not. "This man's file is sealed. His chart has a government stamp on it. The number you called went nowhere. You have no history, no attending physician of record, and no way to treat a presentation you can't identify. She paused. I might be able to get him to talk to you, but I cannot do that with 7 people in the room, because he will not believe it's safe, and if he does not believe it's safe, he will hold this state until his organs begin to actually fail, which, based on his vitals, is somewhere between 4 and 6 hours from now. The room was very quiet. Dr. Salim looked at her for what felt like a long time. 2 minutes, he said. I'm outside the door. The monitors stayed on. Everyone else left. Sylvie stood in the bay alone with the man on the gurney and listened to the building breathe. The ventilation hum, the distant elevator chime, the muffled voice of someone on the phone at the nursing station 30 feet away. She pulled the curtain. She sat down in the chair beside the bed, which was something she almost never did, and she leaned forward with her elbows on the rail and spoke quietly. My name is Sylvie, she said. I'm a nurse. Civilian, you're in Foothills Medical Center in Calgary. It's 0340 hours. You came in by ground ambulance from a staging point near Airdrie. She paused. I heard your signal. I know what it means. I did 14 months at the JTF2 support program out of Petawawa, and I know the Sierra code variant, and I know why you're using it. Another pause. I'm not your handler. I'm not your team. I'm just the person in this room who can tell you that the night staff here is 9 people, none of whom have any government clearance, and that your file is sealed in a way that Dr. Salim cannot get past even if he wants to. Which means that whatever you're protecting, it is protected. She waited. I need you to come up. Not all the way. Just enough to tell me what you need. The finger moved, not the Siri code this time. Something slower. Something deliberate. She watched. He was spelling, letter by letter, tapping against the gurney rail in the same modified interval code. She translated it in the back of her mind, the way she had been trained to translate it, without effort, without counting, the same way you read without thinking about the letters, BADGE. She frowned. Badge, she said quietly. Your badge? Your identification? One tap. Yes. Where is it? He paused. Then, LEFTSHOULDER. She stood. She reached under the trauma blanket that someone had put over him on arrival and found, sewn into the lining of his jacket at the left shoulder, a flat panel. She pressed it. It didn't open. She pressed it again, harder, and she felt something give, not a button, a pressure plate, and a small, rigid card slid partway out. She caught it before it could fall. It was not a standard CF identification card. It was matte black with a series of alphanumeric characters along the bottom edge and a photograph, and what appeared to be a biometric seal. It looked, she thought, like the kind of identification that existed in a bureaucratic category she had not been cleared to know about, even when she was working adjacent to people who held them. She turned it over. On the back, in a font so small she had to hold it close, was a single phone number and a 3-word instruction. The instruction was, speak the call sign. She looked at it for a moment. Then she looked at the man on the gurney and she said very quietly, I need your call sign. He tapped. She translated. Nightjar, she said. He breathed. It was the most significant breath she had ever heard. Not because it was loud, but because it was the first one that wasn't controlled. It was the first breath that came from a body that had decided, after however many hours or days of deciding the opposite, that it was acceptable to be a body again. His blood pressure, visible on the monitor above her, shifted upward. His heart rate, which had been sitting at the extreme low edge of compatible with life, moved 3 beats per minute towards something that looked like resting. He opened his eyes. They were gray, and they were exhausted, and they focused on her face with the precision of someone who had been watching from behind closed lids for long enough to already know the shape of the room. You knew the tap intervals, he said. His voice was rough with disuse, but it was clear. I was support staff, she said. Petawawa, 2019 to 2021. Support staff doesn't get the modified variant. No, she agreed. It doesn't. He looked at her for a moment with the particular look of someone recalibrating an assessment. How long have I been here? About 50 minutes. And the doctor outside is good at his job and is not going to ask you anything you don't want to answer. But I do need to give him something, because right now you look like a man with a neurological event and he is 3 minutes from ordering imaging that will involve moving you through a public hallway. Something moved across his face. Not quite urgency, more like the professional assessment of a logistics problem. "There's a contact number on the card," he said. "I saw it. Call it. Tell them Nightjar is in the nest. They'll send someone inside of 2 hours." She nodded. She stood. "Wait," he said. She waited. The signal. He was looking at the ceiling now. "I'd been running it for 20 minutes. How did you hear it?" "I was folding drapes in Bay 7, she said. "I came because the noise from the team wasn't resolving. You weren't looking for it." "No." He was quiet for a moment. "And you just knew it." "It's been a few years," she said. "But some things hold." He looked at her sideways, which was the first time she had seen him move his head voluntarily, and she thought she saw something in his expression that was trying to be grateful, but had been trained, for a very long time, not to let itself be. "Sylvie," he said. "Yes, I'd rather not have the whole ward know I was tap-coding a call for help in a hospital bed at 4 in the morning. That information will not leave this room from my end," she said. "You'll have to manage Dr. Salim yourself." The corner of his mouth moved. Not quite a smile. "Close enough." She went out. Dr. Salim was leaning against the wall across the corridor with his arms crossed and the focused, careful expression of a physician who has decided to be patient but is monitoring the limits of that patience closely. "He's awake," she said. His presentation was psychogenic, self-induced suppression of autonomic response. It's a Siri technique. He's been trained for it. His vitals are already correcting. She held out the card. "There's a contact number. He's asking us to call it and give them the phrase on the back." Dr. Salim took the card. He read it. He looked up at her. "You want to tell me how a triage nurse on overnight rotation knows what Siri techniques look like in a clinical presentation?" "No," she said pleasantly. He looked at her for another moment. Then he pulled his phone out of his coat pocket and dialed the number. It rang twice. The voice that answered did not give a name or an institution. It simply said, "Go ahead." Dr. Salim looked at Sylvie. Sylvie nodded. "Nightjar is in the nest," he said carefully, as though the words were something he was delivering and didn't fully own. A pause. "We'll have someone there by 05:30, the voice said. "Keep him comfortable. Do not admit him under that name." The call ended. Dr. Salim stood holding his phone with the expression of a man who has crossed into a part of the world he was not trained for and is doing his professional best not to show that it unnerves him. "What do I do with the chart?" he said. "Leave the admission entry," Sylvie said. "Flag it for the incoming contact. They'll know what to do with it. And him? He needs fluids, electrolytes. His glucose will be low." She thought for a moment. "He might eat something if you offered it." "The suppression burns through reserves. I know how to treat a patient, Willette." "I know you do." She went back to Bay 7. She picked up the drapes she had left on the counter and resumed folding them. Her hands were steady. They had been steady all the way through. That was the thing about having done the work she had done, in the places she had done it, with the people she had done it alongside. You didn't get the shaking during. You got it after, in the break room at 4:15 in the morning, with a cup of tea you'd made on autopilot, sitting in the plastic chair by the window, with the parking lot lights making orange shapes on the linoleum floor. She sat in that chair, and she thought about Petawawa, about the building that wasn't on any map, about the instructor who had drilled the modified tap intervals into her over the course of 3 weeks, until she could translate them in her sleep. She thought about the operational debrief that had ended her time there, which had been conducted in a room with no windows by 2 people who never told her their names. She thought about the forms she had signed and the forms she had not been allowed to read before signing them. She thought about the 11 months at Foothills and the slow, deliberate construction of a life that looked entirely ordinary from every angle. The quiet competence, the good coffee, the careful invisibility. She had built that life on purpose. It had seemed, for a long time, like the only reasonable choice. She was still sitting in the chair when the contact arrived at 0522. A woman in civilian clothes, with a laminated badge that she showed to the night security desk without explanation and to no one else, who walked directly to Bay 4, without asking anyone for directions, which meant she had been given a layout, which meant she had been working toward this room for some portion of the night. Sylvie watched her from the corridor. The woman glanced at her once, briefly, with the evaluating look of someone confirming a data point, and Sylvie recognized the look because she had worn it herself in a previous version of her life. The woman went into Bay 4 and pulled the curtain. At 0548, Dr. Salim found Sylvie at the nursing station, finishing her charting for the shift. "He's being moved," Salim said. "Private transport." The woman with the badge took the chart copy and left us a case number and an authorization code for billing. He paused. "He asked me to pass something on to you." Sylvie looked up. He said the intervals hold because the people who teach them know what they're doing, and to tell the Petawawa support staff that their training program has a longer reach than they know. She was quiet for a moment. "That's all?" she said. "That's all." She looked back at her chart. She finished the entry. She closed the file. At 6 in the morning, when the day shift arrived and the overnight team gathered their things and drifted toward the exit in the particular exhausted, unhurried way of people who have been awake long enough to be past tiredness, Sylvie put on her coat and walked out into the October cold. The sun was just starting to come up over the Rockies, the sky going pale gold and gray above the mountains. The air sharp with the particular cold of a Calgary dawn that meant winter was maybe 2 weeks away. She stood in the parking lot for a moment and breathed it in. Nobody knew what she had done that night. No one in that building had the full picture. Not the paramedics who had brought him in, not Dr. Salim, not the woman with the badge who had come to take him away. Each of them had a piece of it. None of them had the shape of the whole thing. She didn't need them to. She got in her car and drove home in the early light and the signal that had come to her in the dark. Those small, careful taps against a gurney rail, sent by a man who had no other way to ask for help, stayed with her the way certain things stay with you. Not loudly, not urgently, but the way a compass needle stays pointing north, steady and useless to ignore.